Welcome to Pennsylvania in Focus. I'm Kristen Smith. Joining me today is the Center Square's Pennsylvania reporter, Christina Lingell. Earlier this week, Christina reported on a rally that was held, a vigil really, at UPMC Altoona to discuss workplace safety. And this is in a rise of at least a year of unfortunate attacks in hospitals. So tell us more about this particular incident and what healthcare workers want to see going forward.
Yeah, so in Altoona, an ER technician, Travis Dunn, was brutally attacked by a patient in the ER a few weeks ago. It left him with a fractured skull, a bleed in the brain, I believe, damage to his teeth, and other injuries. So that was a pretty extreme example of the kind of violence that healthcare workers face. There's a mix of that being just part of the job that's always been part of the job, where we have volatile situations. I mean, you're always in healthcare. You're going to be dealing with people who are in behavioral distress and, acting out in that way. You're also going to deal with people who are coming directly from crime scenes, who are in a violent space from whatever they're coming from. So, and then you have people who are under the influence, you have all that kind of stuff where people are just coming in. That's always going to be the case no matter what. But then what we've seen a lot more of recently are these incidents of people who are distraught. They're frustrated with the healthcare system. They're frustrated with outcomes from themselves, their family members. They're frustrated with having to wait for care or getting inadequate care. And we're seeing people really start to act on that frustration more and more. In York, there was a shooting that killed an officer at UPMC Memorial Hospital there. That was the distraught family member of a patient. And we're seeing this nationwide. I think there was a shooting in Seattle fairly recently. I think that, most of us, even if we have not been in a hospital recently, we have certainly been to the pharmacy or been other places where you see these signs put up that say, like, please don't hurt the staff. Please, violence will not be tolerated. Hostility will not be tolerated. So we're seeing kind of a rise in tension, and a lot of people have pointed to the beginning of the COVID-19 pandemic as the starting point for what a lot of just, regular people are identifying as this rise in tension and loosening of maybe our standards of how we act in public. But obviously this sort of extreme violence goes well beyond that.
And you said that, it's happening all over the country. You just mentioned two very specific incidences in Pennsylvania. One of the big unions in our state, the SEIU, was there, and they had offered a few ways to address the problem. So what would they like to see done?
Yeah. So one of the big issues is that, or at least one of the things that's on the hospital side that they can fix or start to try to fix is patient care. And a big reason that patient care has suffered in recent years is that we do have a really severe staffing shortage. And part of that comes down to the working conditions being such that people aren't staying in jobs in healthcare as long as they used to. We see a lot more reduction of staffing, and that means a lot fewer people are doing the same amount of work, if not more work. And it's increasing wait times. It's increasing tension. It's not as reliable for patient outcomes. When you have more to do and less time to do it, you're probably not as on your game as you could be. So, part of what the staff is asking for is saying, like, pay as living wages and hire more people and make this a better situation so that we have more people working, so that the outcomes are better for patients, so that we don't have this really tense relationship with the people that we're trying to help. When they talk about that, they also cite the huge profits that UPMC makes. So UPMC is one of the biggest healthcare providers in our state, and they make a a good amount of money doing it. There is, of course, huge disparity between how much the workers at a hospital are making and how much the CEO of UPMC is making. That seems like one of the big issues that at least the SEIU brings up, although I think that seems to be a more systemic thing. Even if we were to pay everyone better, the state would still have to probably make some changes to incentivize more people to enter into that healthcare stream, because we just have this demographic crisis that we're in the middle of, where we have more people who need to be taken care of and fewer people who can take care of them. So, solving that mismatch is something that's going to have to happen from the ground up when it comes to incentivizing students or finding ways to get people into these careers.
Governor Shapiro and the legislature they've tried to do that over the last couple of years by incentivizing, teaching or nursing programs and trying to make licensure easy so that nurses coming from other states have more of a seamless transition. So they do see it as a piece of this puzzle that solves this broader problem. But I think you make an interesting point about systemic nature and SEIU's point about, disparities in pay. I mean, all we have to do is look at one of the most infamous crimes of the last few years, and that would be Luigi Mangione, who allegedly murdered United Healthcare CEO in cold blood. And it was because of a lot of these issues that you're talking about and the unfairness of our healthcare system. But it is much broader than just pay people more and they will come. It's systemic, as you mentioned. So given that and, the nature of all of this, has the hospital made any comments about this issue?
Yeah, the hospital said, they're deeply concerned about the issue. They're responding with security measures. They also said that they would be fully covering Travis Dunn throughout his recovery in terms of his medical care and his time off. I think that the staff are saying, be more proactive about this. This isn't something that you should be responding to. We've been talking about the violence that we see pretty regularly for a while. So I think, UPMC isn't denying the problem and they are doing what they can to address it. But it would appear from, their statements that at least SEIU workers and those who have spoken up about it are not as optimistic based on the history since UPMC took over their hospital in Altoona.
All right, Christina, well, I know that you will keep on top of this story. So to check it out, visit thecentersquare.com/Pennsylvania.